talk about development, we usually think about factories, highways, big investments, digital economy, fancy growth numbers and whatnot. But here's the real question. Can India sustain this development that we are imagining and talking about if its citizens are frequently sick? So here's an important note, that highways and factories might actually build the economy, but it is actually productive and healthy citizens which will sustain it. And when we are looking towards this being a developed economy for India, we have to remember that health literacy is essential, not optional. Hello everyone, welcome to Vajram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to take a deep dive around the status of, importance of health literacy, why it is the real growth engine of India's economy when it is working towards becoming Viksit Bharat by 2047. So when we are talking about the real engine of growth, today we are going to take the case study of health literacy. When we are talking about health literacy, we have to start from the fact where I started this session with, that when we are talking about a developed country, it just not needs a healthy workforce, but also active women workforce, productive elderly population and also lower medical debt. It is such an ecosystem which is going to actually facilitate and become the real engine of economic growth that lies in front and that will take us towards what we are imagining to be a developed country by 2047. Because if we don't bring this into picture, we might not be laying our pathway right. And that is what we will be understanding in detail today. Starting with what exactly is health literacy and why are we talking about it. So when I talk about health literacy, it basically means that whenever we are referring to any individual, he has basic health information. For example, if he has cold, if he has some issue, he does not take it lightly, he knows when to see the doctor. He knows he should be taking prescribed medicines. He should not be going for the over-the-counter medicines. He should know that how to follow the medicine properly so as to ensure that there is not an antimicrobial resistance developing. And he should also know that prevention is better than cure. That what are the precautions that can be taken to prevent disease before they become serious for that particular person. So in short, it is nothing but your ability to take care of yourself and your health in a smart and aware manner. If we translate this into economic terms and numbers, this should mean health awareness, health literacy should mean that you have to visit the doctor less often. How will that happen? When you have fewer sick days. If you are visiting the doctor less often, that means your hospital costs will reduce, and if you are falling sick less, that means you will be able to perform better. It's not just about work, in your life as well, you will be able to excel better. So this is what we are referring to as health literacy. And if this health literacy is the core, it is at the base of our citizens and economy, this is what is going to facilitate presence of healthy people, and these healthy people will be responsible for building strong, resilient and developed economies, and in this case, India. Now, here might crop up a question that when are we talking about health literacy, why are we directly plugging at as a primary real growth engine for India? Why does it matter for India so much? For that, we need to look into some very important numbers. A global study which has been conducted by the Economist Impact, they have clearly found out if India changes its number, that means reduces the abysmally low health literacy rate by 25%, our whole country could actually save $12 billion every year. Now, when we are talking about this huge number, how are we planning to save it? How are they saying this can be done? They are saying this amount is coming because people do not understand about their health and how to tackle it. And that is why they have to spend almost 3 times more on the treatment, because they visit hospital late, and that is when we get to see that this amount is being spent. So if we reduce our health literacy number by 25%, if we increase our health literacy, that means the number of people who have lacking health awareness, they are reduced by 25%. That is when we will be able to save this amount. So when we are understanding the essence of this amount, you have to also see that this money can easily go into education. It can go into businesses, investment and savings, which will be very much required for us to become a developed economy. And that is not it. There are other dimensions as well associated to it, which we'll be talking about. But for the basis, first for the start, let us conclude on the fact that if we are saving not just money, but are focusing on our health, this health knowledge, this health literacy, it is going to not only save national wealth, but it will contribute to its development as well. Now in this context, let us start with the first dimension. In order to understand that how this can be done, let us also focus more upon that why is this so important. How does health literacy actually impact your productivity? Let us start with this very prominent example when we are talking about February, how we have seen December, January, February across our country, where one of the most prominent news is have been about worsening AQI. So when we are talking about AQI, in this context, we need air pollution awareness. For example, people need to know that yes, this is a situation, but they can protect themselves better as well. They should be using masks frequently. The number of people who are using masks is almost negligible. People need to be aware if there is a problem, they can go for an early treatment, which will result in what? Fewer lung diseases, which will result in what? Higher productivity. And we are talking about a huge number at stake. And similar examples exist. For example, anemia in women. This is something we see, the low hemoglobin, and especially in India, where 57% of women who are aged between 15 to 49, they are anemic. If that is addressed, if that is reduced, women will be able to contribute to the workforce more productively, will contribute more than $8 billion every year for our economy. For other normal things which we do not even consider as problems, such as back pain and body aches, if there is better awareness, there will be lesser workdays loss, there will be better labor output, and small preventive actions can bring in big economic impact. So that is why health literacy, it is at this small level that health literacy can cause huge impacts and small contributions to it. If you think, if I am doing it, what about others? Then actually just imagine the culmination of efforts can bring in such huge numbers for our economy. Now when we are talking about importance, we need to also look into another dimension, that how does it reduce inequality as well. Because when we are talking about importance, it also we need to understand that it will be effectively reducing inequality also. How? Because when we are talking about low health literacy, let us ask a question, who suffers the most? We know underprivileged, women, poor household, elderly people and rural communities. If without awareness, they will be spending more on treatment, these people. They will be spending more, falling into debt and also drop out of work. Economically, if you add all these numbers, they are not great, because it is not only increasing the consumption expenditure of these people, but at the same time it is succumbing them under debt, and it is also reducing the productivity in the economy. So it is a lose-lose situation. But imagine health literacy brought in, these people would be suffering less, they would not have to spend more on treatment, they will not be falling into debt, and there will be enhanced productivity. So small change, bigger rewards are present here, and when these are the people who are suffering most, then this inequality would also be addressed. Now that we have understood the importance in terms of health literacy, now let us move to another dimension here, that what are the consequences if we do not do this? What happens if India ignores this health literacy like for the longest time we have done? We have to seriously understand the consequences, that it is not just about higher healthcare cost, because the later you go into the treatment, the more expenditure you have to do to get cured from the disease, but it is also about lower productivity. Late treatment, more sick days, lower output. Furthermore, you have to understand, apart from formal workspace which allows you medical leaves, there is a huge informal workspace that exists in India, and there we get to see more suffer because they do not have provision of leaves. So that means they do not get paid for the days they are not showing up. That means no work, no income, higher possibility of falling into debt trap, and also lost productivity in upcoming days. And what will all of this do? This will lead to a fiscal pressure on government, because government would have to spend more to make sure that the avoidable diseases are not caught on as a serious problem in the economy. Let me give an example here. Government has to spend so much on awareness of dengue every monsoon season, so as to ensure when this disease can be avoided, it should be through awareness. So that will, if other disease also catch up on this, there will be more spending that will be done by the government. So I think these are reason enough, consequences enough, that we should turn, we should expect the government's movement, people's movement, academia's movement towards health literacy. On this note, I want to ask you a question here. Do you know how much has been the budget expenditure allocated to health this time? And I want you to compare it with the developed economy's health expenditure. I think that will also give you an answer that how we are not looking towards health literacy, and we need to. So in this context, we have another important dimension here in terms of consequences, that is, in terms of consequences, it is very simple. For example, just like this economic chain. If we have low health awareness, it will lead to more diseases. More diseases will lead to higher cost, more lost work days, and that will move towards lower GDP growth. So if we are ignoring health literacy, that means we are slowing down the development in itself. And if we want to address this, we have to start working today itself, and that, let's understand, should through way forward. That what exactly India should do. As of now, health literacy should be a national development strategy. It shouldn't be a health campaign, it should not be a health awareness program, it should be a strategy. And it should start at the grassroots level. That means with school education, be it Anganwadi, ASHA programs, workplace safety rules. So at all the levels and all the phases of life, this needs to be implemented. And when we are talking about digital economy, digital health apps, community awareness drives, where people are getting to know better about their health, how to handle it smartly, so as to ensure that in long term, this actually brings in more productivity rather than reducing it. And how this can be done? The government can put it in pipeline along with Ayushman Bharat, National Health Mission, so as to ensure that the illnesses that is taking away the economic output, that is prevented. Because when we are talking about insurance, we are trying to expand the insurance net. But insurance is for when you have already fallen sick. When we are talking about health awareness and health literacy, it is for before falling sick and preventing that sickness, preventing that illness. And we always have been taught prevention is better than cure. Prevention is also cheaper than cure. And this works not just for you, but for the economy as well. Now, after discussing so many dimensions around it, we need to go to the final question where we started with it. Can India become a developed economy without health literacy? So in that context, you need to know that if we want to become developed, we need a lot of things such as high productivity, healthy workforce, strong female participation, healthy aging population, and lower medical debt. And this can be ensured through health literacy itself. If health literacy comes into the picture, it is not only going to improve human capital, labor efficiency, but also economic resilience. So our answer is right here. We just need to make sure that it is implemented. What are your thoughts on this? Let me know in the comment section. That was all from my side. Thank you so much.